This is Columbus Community Hospital Healthcasts. I'm Bill Klaproth. In this episode, we talk about orthopedics and sports medicine with Dr. Michael Pitner, an orthopedic surgeon at Columbus Community Hospital. Dr. Pitner, welcome.
Thank you, Bill. Thanks for having me on today. I appreciate the opportunity.
Absolutely. This is such a big topic. So excited to talk to you about this today. So what are the most common bone, joint, muscle, and sports injuries you see in your practice? And why are these problems becoming so common today?
Absolutely. In our clinic, we see just about everything from sprains and strains all the way to fracture care and arthritis and injury. They're so prevalent today, I think, because people are so active today, not just in their youth, but even into their older age. There's activities now that are easier and easier to do for an older population, but with that activity does come the risk of injury.
I imagine with all the pickleball players out there now, that is adding to it. When you say people are more active as they get older, I think that is absolutely true. So what are some of the biggest risk factors you see for injuries, like the bigger ones, ACL tears, rotator cuff problems that we hear a lot about, stress fractures, you mentioned strains, sprains, things like that, or even how about early arthritis in the knees and hips?
We know when it comes to things like arthritis or wear and tear type injuries like rotator cuff disease, we know there is some genetic component to that. I tell my patients it's not necessarily mom and dad had this happen, so therefore I will have it happen, or they didn't have it, so I won't have it. But there is a genetic component to that. There's also a wear and tear component, a use. So people that are active for a long time or many years are at risk for that. We also know that it's the significance or the physicality of activities. People that are competitive athletes that are pushing the edge of what they can do and what their bodies can do, unfortunately, are at risk for injury like that, talking about ACLs or meniscus injuries.
So then how do you decide between rest, physical therapy, injections, and then even surgery? And then what are some of the newer, less invasive treatments in orthopedics and sports medicine right now that you use?
Absolutely. For me, it's sitting down and having a good conversation with each of my patients and trying to understand what's led up to their visit with me that day, what their goals are, what their current activity level is, and letting that guide how we treat that. Many times that means not surgery. It means doing things like modifying activities, taking some medication, working with physical therapy teams, or in the younger setting, even the athletic training staff at some of the schools, and doing rehab for injuries. You're absolutely right. There is a role for injections for many of these things, whether it's joint injections, tendon injections, and there's different types of injections even, and seeing who may be a candidate for that and who may benefit from that. And then many times if those fail, or if it's a more severe injury from the onset, starting to discuss surgical options. I tell my patients I try to manage things without a surgery as often as I can, but unfortunately, sometimes there still is that role.
Yeah, I like how you say you have specific conversations as a guide to where to go for treatment. So that really is an important component. For someone watching this right now or listening, what are some of the most effective everyday habits? We hear about stretching and warm-ups and things like that that really do help prevent common sports and joint injuries.
Absolutely. And I think it's walking the line between staying active without being so active and allowing the body rest to where it can have some rehabilitation, and so you don't get these overuse injuries. Like you mentioned, stretching is so important, but also so is recovery and after the activity, kind of what you're doing and being on a good regimen with that. Nutrition is so important. There's things on both sides of the activity, both the getting ready and the rehab after.
I love what you had to say there. I think sometimes we forget about that recovery. We hear about the stretching before, but the recovery after is so important. And then you even mentioned paying attention to nutrition and things like that are very important as well. So, can you talk to us about some of the new technologies, such as advanced imaging, joint preserving surgeries, wearable devices, or even rehab apps, all of this technology that we're getting flooded with today? How are those things changing the way you diagnose and treat injuries?
There's a lot more science that goes into it than I think ever before, and a lot more technology that goes into some of these things. We have things like force plates, wearable technology, like you mentioned. And I think those are all really great resources to even help the general population screen themselves for abnormalities in their health. Now, I think it's still important to have a good conversation with a physician or a provider on taking that data and applying it to the specifics of their life and their goals. But using that technology has been very helpful in both the screening for injury and then in recovery as well. With physical therapy now, like I mentioned, we have force plates that can show exactly how much force somebody's putting on a leg. And it's not just sort of eyeballing things anymore. It's giving them a really structured, detailed post-operative or rehabilitation plan tailored to what they need, which may be different from what somebody else with a similar injury or surgery, maybe they need something different. Being able to customize the treatment plan because of these technologies, I think has been really great.
So it sounds like using the tools and technologies available today has actually helped you in your diagnosis and then subsequent treatment. Would that be right?
Absolutely.
Yeah, that's good to hear. So, I recently sprained my knee. So, I've been going through some PT. And so, this next question, I know that a lot of people feel scared or discouraged when they're told they need months of rehab or possible surgery. I don't need surgery, but the rehab time is like, how long is this going to take? I know what that feeling is like. What do you say to patients who are afraid they'll never get back to normal? Like, man, is this thing ever going to heal? Which I have felt.
The first thing I tell them is it is frustrating. I think acknowledging how the feelings they have coming into it can go a long way towards them building a rapport with their physician and making it feel like they have a partner on the journey that they're about to walk. And I think acknowledging that up front is important. I think telling them that, through experience and training, I've seen people that are in a similar situation to you that had improvement, albeit even if it takes months and months and months, but that knowing that I'm going to be with you along that entire journey. And if things change or things alter, then we can pivot our plan. And knowing that they have that flexibility as we move forward and somebody that's helping to guide them throughout the whole process, I think can offer some reassurance in what can otherwise be sometimes a frustrating, almost scary, anxiety provoking journey.
I think that's the thing that really separates Columbus Community Hospital. What you just said, Dr. Pitner, is that I'm with you. I'm going to be along this journey right there. And then if we let's see how it goes. And if we have to alter the treatment, then we'll make that decision when that time comes. I mean, that's how you treat that. And that does give people comfort. Is that right?
I think so. And I would agree. I think Columbus Community Hospital is just that. It's a community hospital. They're ingrained in the community. And I think they have a good understanding of the community members, what the town looks like, the interests of the town. And I think that's really helpful in applying treatment plans, again, in sort of a custom tailored way.
Absolutely. It's always better when you know you have somebody going along with you on the health journey that you're on, no matter what it is. It's always nice to know you've got somebody there that has your back. So, love how you answered that, Dr. Pitner. And then for someone dealing with ongoing joint or sports related pain right now, what's one practical step they can take this week to move toward getting better?
One thing is I tell people that to the best of your ability, keep up your activity level, keep your range of motion up. We know that cartilage and bone and soft tissue, they like motion. And so there is a little bit of a use it or lose it type mentality many times. Not that I want people to be out torturing themselves if they're in pain, but in general, continuing to be as active as they feel capable of being is going to be really helpful in the long term. And even if it comes to where you do have to have some sort of medical intervention, we know that people going into medical interventions that are stronger and more active tend to come out the other side perhaps quicker and better off.
I'm learning that with my own PT. That's so true. If I sit too long, when I get up, man, the knee is really stiff. It's hard. But if I just remind myself, get up, keep moving a little bit, it certainly feels a lot better. So that's great advice. Dr. Pitner, thank you so much for your time today. This has really been great.
Absolutely. Thank you. Like I said, I appreciate the opportunity to talk with you today.
Absolutely. Thank you again. Once again, that is Dr. Michael Pitner. And for more information and resources, please visit columbusorthopedics.com. columbusorthopedics.com. They are there to help you. Go visit that website right now. And if you found this podcast helpful, please share it on your social channels and check out the entire podcast library for topics of interest to you. This is Columbus Community Healthcasts. Thanks for listening.